shopping list, the stress of dressing up just to go and buy salt. Who can relate? If you know, you know. Is another Saturday, weekend, and another weekend for Nugs Russia, as we widen up our engagement net to connect to a great and awesome guest. A big thank you to the leadership of Nugs Russia, headed by His Excellency Yamwajisi Derek, for making this possible. Tonight, we are going to get knowledge on population dynamics and how it affects national development. Should it be a priority? Should it be an option? Our guest for tonight is a well-accomplished woman. Her achievements are undeniably inspiring. Ladies and gentlemen, Dr. Leticia Adelaide Appiah was appointed the Executive Director of the National Population Council in November 2016. Preceding this, she has served in various capacities within the Ghana Health Service as a medical officer, senior medical officer, and public health specialist for over 2 decades, from 1994 to 2007, after which she became the first municipal director of the health services for Lejokuko Kowo municipality from 2008 to 2016. Through her leadership, efforts, and collaboration, the Lekma Polyclinic and Hospital were built and made operational. Dr. Leticia, a physician, a public health specialist, and a global expert in population and development, has been instrumental in repositioning the unfinished business on population dynamics and development issues in Ghana and sub-Saharan Africa. Through her relentless efforts, the 94 population policy was revised to the existing one. Currently, Dr. Appiah is a member of the Structural Analysis Team for ECOWAS Vision 2050, a consultant in the demography to the UN, a member of Ghana's COVID-19 Task Force and Ghana Medical Association. She was also a member of the 2021 National Census Steering Committee. She is a Humphrey Fellow and the Vice President of the Hubert Humphrey Fellowship Alumni, Ghana Chapter. She's a board member of Partners in Population and Development, an intergovernmental organization of 27 countries promoting South cooperation. She is a board member for the Tamale Teaching Hospital and Ghana AIDS Commission. She has a PhD in public health with specialization in population, family and reproductive health, a master's degree in public health with specialization in epidemiology and preventive medicine from the University of Ghana. She is a product of Donetsk Medical School in Ukraine for her medical degree and Emory University, Atlanta, USA, for her Humphrey Fellowship Program. Ladies and gentlemen, join me welcome Honorable Dr. Appiah to give us a lecture on today's topic. Doc, you're welcome.
Thank you so much, Joy, for that very detailed introduction on a Saturday evening. I think Saturday evenings would have short introductions, but then, yeah. So I will share my slides so that we can all. Am I sharing the slides?
It's not visible yet.
It's not visible yet. Where's it going to?
Slides now.
Okay. It's still not visible.
No, please.
Let me try. Oh, okay. It says But it says sharing. I don't know. Yeah. Can
anyone else see it?
Can you help me? I have to share the slides. I have to share this slide. This one. Okay. But it's not sharing. This one. Yeah. It's not sharing.
I can see it now.
Oh, good. Excellent. Thank you. Yes. So thanks for the opportunity once again. We're going to be talking about population dynamics, whether it's an option or a priority. But before I go on, I have a little questionnaire, 5 questions for you to answer. You will keep your marks, and then at the end of it, we would still go through the same 5 questions. So the first question I have is, or the first statement is not a question, it's a statement. So just write it down. Population dynamics affects you personally. The answers, the options are yes, no, and don't know. Okay? That's the first question. Population dynamics affects you personally. Yes, no, don't know. Should I go on?
Yes, please.
The second question is, population dynamics determines quality of life and life expectancy. And the answers are yes, no, don't know. Population dynamics determines quality of life and life expectancy. Yes, no, and don't know. The third question is it important for governments and private sector to improve family planning education services and family planning education and service provision? Is it important for government and private sector to promote family planning education and service provision? The options are yes, no, and do not know. That's the third. And the fourth question, is it important for members of SOTGA to promote family planning education and services? And the answers are still yes, no, and don't know. Then now the final question. Population dynamic is a priority, not an option. Yes, no, don't know, and undecided. The final question, population dynamics is a priority, not an option. And the answers are yes, no, don't know, undecided. So you mark yourselves, and then at the end of it, we will go through the same 5 questions, and we will conclude. So the outline of my presentation, I'm going to give you a little background of the National Population Council. I realize a lot of people don't know about it. Then I'm going to take you through something they call the Celery test and the Golden Circle. The Celery test, the Golden Circle. Then I would move on to say why we do what we do, how we do what we do, and then the conclusion. I've realized that simplicity is still the best way to go. Everybody understands why we do, how we do, and what we do, and the conclusion. Now, the vision of the National Population Council is improved and sustained quality of life for the people of Ghana through effective management of population and its related issues. So our vision states is inherent that population dynamics is not a given. You can modulate it. That is why it says through effective management of population and related issues. And this is in the Constitution. So the background of the vision is Article 37, Clause 4 of our 1992 Constitution states that the state of Ghana shall maintain a population policy consistent with the aspirations and development needs and objectives of the people of Ghana. Now we are talking about sustainable development goals. We are talking about Ghana beyond aid. We are talking about Africa we want. It states that we shall maintain a population policy consistent, which means that population policies modulate populations. 1994, the National Population Council was established by an act of parliament as the highest advisory body to the government of Ghana on population and related issues. So that what we do is advice, and you know that as for advice, you can take it or leave it. But I would want you to know that Ghana was the third country in Africa to actually have a population policy after Kenya and Mauritius. So we had a population policy in '69, but not in the constitution. But then in '94, we had it in the constitution, which means that we have actually had a population policy before. And population policies, every country has a population policy, whether it's documented or not, whether you know it or not, because the parameters of population is fertility, mortality, and migration. So as long as you are fertile, you are migrating, and you are dying, that is your population policy. You can influence it or not, but every single country has a population policy. Since everybody gives birth, everybody dies, and things like that. So I just would want you to know that that is the issue. Now with the background, we will go through the celery test. The celery test is by one Simon Sinek. And he says that why you do what you do is the most important. So for instance, if you want to live a healthy life, you know what to buy. If you just want to fill your stomach, you also know what you buy. So the celery test determines your actions after deciding on why you want to do what you do. So if you want to be healthy, then you do not go for the cakes and the fried foods and all that, but then you go for the vegetables and the fruits. So that is really what the celery test is about. And any decision that you take should pass through the celery test. Why do you do what you do? Why did you go to Soviet Union? Why did you go to this university? Why are you eating this food? Why are you studying? You are not doing it for doing sake, but you are doing for a reason. He represents the celery test in a golden circle. And he says that every organization knows what they do and how they do it, but very few organizations know why they do what they do. And the why is not about making money. Money is a byproduct of the why. It is the result, it is the purpose, it is the cause or belief. It is the reason why the organization exists. So the organization does not exist to make money, but the organization exists to give services, and as returns, you make money. So that is how he says that when you look at why you do what you do, how you do what you do, then everybody automatically knows what you do. So if you want people to buy into what you are doing, it is important to start with why you do what you do. And I think I agree with him. That is why I put in the celery test. So now with that in the background, we are zooming into why we do what we do. So I end the celery test, and now I go on with why we do what we do. So the National Population Council, why do we do what we do? We do what we do because every economy is populated by overlapping generations of three people, of people who live in three periods, starting from birth to childhood, to adulthood, old age, and death. I think every family goes through this, every country goes through this, every community goes through this. And as the farmers will tell you, the starting, when you put the seed in the soil, the type of soil you put it in determines the outcome of the crop. The seed can be good. If the environment is not good, you don't get a good yield. The seed can be bad. If the environment is not good, you don't get a good yield. So you need a good seed, good environment, proper timing for optimal outcome. So it is in population. So the starting point, that is starting with birth, that is the most important place that the population policies try to influence, because there's no country that is interested in increasing their death rates, but every country is interested in increasing the health of its population, because a healthy population is productive. An unhealthy population consumes more than they produce. So that is it. Now, why do we do what we do still? We do what we do because all the overlapping people from childhood, adulthood to old age are all consumers, but not all are producers at any one time. 40 years ago, I was a consumer. I was not a producer. Today, I'm producing and I'm consuming. And so it is important that you look at that ratio, because consumers cannot be more than producers, and producers cannot compromise their health in producing consumers. I hope I'm making sense. You can stop me, but I would wish that I go through. It's not a very long presentation, but it's important that we understand why we do what we do. So all of us, childhood, adolescent, old people, we need food, okay? Some will need health. I mean, all will need health. All will need housing. Some will need education. All will need sanitation. Some will need employment. Everybody will need utilities. Some will need pension, social services, security. So there's consumption, investment, and savings by these people. But you realize that all decisions are made in adulthood. So it's the adults who are producing, the adults who are saving, who are investing, but everybody else is consuming. So you cannot have consumers overwhelming producers. That is so important. And I hope that afterwards we will see and identify some of our problems as families, as countries, and even as a sub-Saharan Africa. So why do we do what we do? We do what we do because we want women to get pregnant when they are healthiest for optimal outcome of baby and mother. That is basically why we do what we do. Just like the farmers do not plant their seed in the dry season. You can have a good seed you plant in dry season, you don't get a good outcome. So you can have a genetically healthy mother, she gets pregnant not at the right time, you don't get a good outcome, not because the seed is bad, but it's the timing. So we look at what can we get maximum impact at minimal cost. That is what the term efficiency. And we know that the first 1,000 days of life is so important for the outcome of any pregnancy. So women's health, prenatal and intrapartum sets the foundation for anybody. You miss this point, foundation is like the foundation of a building. You get cracks, you keep maintaining, you get cracks, you keep maintaining, but it is not as strong as if you set a good foundation. So this is the foundation of life. Unfortunately, we do not get a lot of advocates because we don't even know the people we are advocating for. I don't even know the babies who are in their mother's wombs, who I want them healthy. So we do this to ensure healthy children, healthy families, healthy communities, and a healthy nation for sustainable socioeconomic development. The most important resource of any nation is a healthy person, and then the time. Time, you cannot change it. Everybody has 24 hours. But for health, you can alter your health if we all agree that the beginning of life is important. And this is consistent with our Constitution, Article 37, Clause 4, which states that we shall maintain a population policy consistent with the aspirations of the country. So when you see street children, you should know that we are implementing a population policy that is not consistent with our aspirations as a nation. So why do we do what we do? To enable people, children, adolescents, and aged lead healthier, happier, prosperous life from generation to generation in harmony with the environment. So this is what we want every family to have. This is really what every family should have, with children, grandchildren, where there's cultural transfer, where there's peace, where there's harmony, and children are growing not on the streets, but in homes and being loved and nurtured, because peace and love is actually, for me, the state of man. And that is what population policies seek to do. So population policies are not controlling. Population policies are information giving for us to make good decisions. As a medical doctor, when you come to my facility and I prescribe antihypertensives for you to take, I'm not controlling you. I'm giving you the information and services so that you can be healthy. That is basically what it is. So this is why we do what we do. This is what we want, without any inequalities, because inequalities have issues that are very difficult to deal with. So how do we do what we do? We demonstrate the health, educational, employment, environmental, and security implications starting with pregnancy. You see, a lot of the things we are dealing with are symptoms of a problem. We have to look at the cause and effect. We are dealing with a lot of effects and not looking at the cause. But because at times the cause looks far away from the effect, and so we just focus on the effect. The children are there, let's build schools, let's build hospitals, let's do that, not looking at the root cause. So I put some data from our own data, country data. And in our data, the MHS is the Maternal and Health Survey Report 2017. It shows that 48.7%, about 50% of our pregnancies were not in optimal state, which means they were either too close, either too early, too late, or too many. So if we're actually living by a population policy, it means that we would have had fewer healthier babies, and fewer healthier babies will translate into reducing our population growth rate, reducing our budgets, our health budgets, with optimal health outcomes. But because we have 48.7% of our pregnancies not in optimal state, we have, in addition to high population growth rate, we have increased health budgets and suboptimal health outcomes. It is not by choice that the life expectancy of Sub-Saharan Africa is the least globally. So we have increased health budget, and suboptimal health outcome. Then we also have increased educational bill and suboptimal quality of education. We have high employment, high unemployment, and high unemployability. Then we have state of insecurity. We have negative, you know, I put, let me just forget about the red slides. That is for other countries. So we have state of insecurity, high unemployment and high unemployability. And so when we look at the high unemployment rates, and then people are screaming, then we have 100 children in schools, and we keep building the schools without looking at the source of the problem. We can never solve it, because no nation globally has solved their population issues just by increasing the number of infrastructure. They have looked at the source, and then you also have high maternal mortalities, because higher risk pregnancies gives you high maternal mortalities and morbidities. It is like driving at 120 kilometers per hour on the motorway and me going 80. If we have an accident, the probability of the 80 surviving, it's more than the 120 surviving. So those are some of the implications of that. So high population growth rate, and it is actually documented, but when the population growth rate is above 2%, it inhibits effort to raise income of families because of high birth rate and the young age structure. So if you have very young people who need education, who need resources, who need health, who need to be cared for, you know, they are consumers, then you have fewer people who are producing, you just stretch very thinly. And so now quantity becomes the issue and quality is compromised. So you have high bills for expansion and replacement just to maintain the quality of life. So when you hear people saying that when we were in school in Prempeh in those days, the whole school population was 500, and now they tell you it's 2,000, and now the children are standing to eat. We learned how to use fork and knife in secondary schools. Now they stand to eat. So even when they become big men and big women, then they go for lunches with other people from other countries. Table manners becomes a problem. You see, so it is not that easy. And this creates economic insecurity, mainly in high fertility households, which in turn encourages them to have large families, which becomes a poverty trap. Because now they think that the numbers will give them security, so they have more and they become more poor, and then they have more and they become poorer, which has to be broken with population policies that are intentional and targeted. So there's poverty and lack of economic opportunities increases incentives to exploit natural resources, leading to environmental degradation. We're talking about Galamsey. The rich people are not in the pits. The rich people are not in the pits. It's those people who we have left on the streets with no education, with no skills, who jump into the pits when the rich people buy the trucks. And that is what happens. Of course, you become, it becomes a survival mood. So you do not think about the environment, you just need to survive. And that's what happens. So what are some of the results? These are some of the results. So you have teenage pregnancies. Then you have schools under trees when people are getting automated. COVID came, we are doing virtual learning, and we are putting our children in a state of permanent vulnerability through no fault of theirs. And these children are supposed to compete globally because it's a global village. They are supposed to compete with children from other places. In China, now they are teaching their children to code from 4 years to 18 years, mandatory coding. And we have children who are hungry and being taught under trees, and they can barely no clothes on them. What exactly is their crime? Then, so the health bill increases. The Ghana Health Service gave us some data where teenage pregnancy is about 100,000 a year. So in 5 years, it's over 500,000, and these are just reported cases. And so there will of course be high morbidity and mortality because the mothers were not healthy prior to pregnancy. And this is not rocket science. If you are not healthy prior to pregnancy, there will be poor outcomes at higher costs because these babies will be preterm babies. They will need incubators. They will need the services that, we have to pay for to keep their babies. I had 3 children. I just gave birth in the morning. In the evening, I got up and went home. These women would not attend antenatal. They would have preterm babies, and NICU services will suffer. Then women who have actually married and a few of them have preterm babies will be competing with these babies. And in medical field, we do triaging. The sicker you are, the more we take care of you, irrespective of whether you are a teenager or you are a mother or you are married or not. But children have no business in labor wards. When you do not focus on your population policies, children compete for space in labor wards. So this is the figure that we have. How many of them preterm? How many of them will be malnourished? I mentioned the first 1,000 days of life critical. So how is it affecting this? Children having children. How many sick children, mental, physical? Even women who are married can go to postpartum mental disorders. What about the children? And the financial and social costs, the long-term impacts, and diseases. Some of the diseases are influenced by poor nutrition, heart disease, diabetes, hypertension, malnutrition, and educational outcomes. So we are just sentencing them to a life of survival, sentencing them to a life that for me is even worse than what happened in the slave trade, because slave trade were people we do not know, but these are our own people. We are putting them through that because we're not giving the right information and the right services. Then the educational bill. So there's increase in absolute numbers, malnutrition, suboptimal teacher-people ratio, infrastructural deficit, increased educational bill, and poor health and poor outcomes. Then, of course, high unemployment and unemployabilities. Look at the pictures I have shown. Where will these people be in the next 10, 15 years? Is it for the IGP to deal with or for Galamsey to deal with? Because humans don't just disappear. They try to survive. Why should the country, should the continent take its people through such means? Is it dignity enough? Then we have insecurity. And I would want you to pay attention to the first part. A system that is indifferent to who becomes parents or how parents treat their children has forgotten that the unit of nation building is the family. The unit of nation building is the family, and the child is the most important. You have broken children today, or you have children who are suffering today. Be prepared for a broken society tomorrow. That is what happens. So hungry, poorly educated, in huge numbers, poorly housed, low productivity, and anemic in values is a system we have created by default or design. And this is very fits into a system of insecurity. Then there's a lot of human capital to death, organized and illegal migration. You know, the Westerners are solving their human capital issue with organized migration. So organized and illegal migration, loss of human capital. So the few who are even good would leave us. Then what do? We have high funeral costs. I'm sure today a lot of you have attended funerals. Now we attend funerals not only on Saturdays, but from Monday to Friday. We should be asking questions. Why we do what we do? The celery test, some syntax, this thing is so important. Why do we have so many funerals? Meanwhile, you travel outside, you don't even see one funeral. So we have high funeral costs, loss of time and energy for productivity, for productive activity, because you cannot use the mind to the same mind to plan for a funeral, to plan to go to space. You can't. You cannot think of going to space when you have to plan a funeral. You can only think of going to space when you are stable and you are at peace. But we have put ourselves in this a constant state of stress and insecurity. So now there's insecurity. Children on the streets, children armed, children working in galamseys, and there's no white man. And then we say we are talking about slavery, that reparation. This and slavery, which one is worse? Let's take the let's decide. I'll be finished soon. Please, they shouldn't leave me. They shouldn't leave me. They should wait. I'll be done soon. You know, so I'm actually in Tamale. We finished the board meeting, and so that's why I just interrupted. You know, so that is it. This and slavery, which one is better? Slavery, we captured old people who they did not know. These are our children who we are taking through this. Is it sentencing them to death or what? We need to answer. Now there's lack of dignity. So much lack of dignity. You know, life is full of choices and it has cause and effect. Look at this. Even during slavery, they shipped us to places. Now we join the ship in so many ways, no dignity. And then we get angry when people treat us in certain ways, when we treat ourselves worse. We should learn to look inwards and not always, because people will treat you the way you treat yourself. Look at what we've done to ourselves. Because these people, they do not need us for organized migration, and we have caused this state of insecurity and stress in our country. So we take this route and we end up this way. So we're sentencing ourselves and making the oceans and deserts our burial places. So what do? Education, like we're doing. We have to educate, population education, to improve well-being of families and communities. Population education, population services, it's far from controlling. It is to improve well-being of families and communities. Then to protect population reproductive health policy, to improve population health and reduce health disparities. It is like half of us are full, half of us are hungry. Averagely, we are all probably not hungry, but that is not it. Every human being has dignity. Every human being has a right to good life, has a right to education, shelter, and all that. So we reduce the health disparities, because if you do not reduce health disparities, you can never work, you can never progress, because the other half that is sick would consume all the investments by the other half. So it doesn't work that way. And we promote family planning and reproductive health information and services as critical preventive healthcare measures with benefits beyond the health sector. Family planning is one intervention with benefits far, far, far beyond the health sector, into education, into how long you live, into a skill. Why don't they have a sorry, you know, so that is it. So what we do, we are moving the country from an illness to a wellness paradigm. So don't give birth anyhow so that we take care of you, but have a healthy outcome of a mother and baby after any pregnancy. That is why maternal mortalities are low out there. Without us changing anything in the country, if we can focus on reducing the high-risk pregnancies, automatically our maternal mortalities will come down. It's like without building any other hospitals along Aflao, if we can reduce our speed on that road, automatically road traffic accidents and its consequences will come down. This is not rocket science. Without doing anything in Aflao, that is what can happen. So what do? We empower. Health, education, nutrition. These three are the triad of sustainable development. And nutrition is not when you are born, even before you are born. Like somebody rightly said, you are a product of what your mother ate and what you are eating. Because your mother was the medium in which you were planted, and that seed now continues to grow. So it is very important. Like I said, unfortunately, the people we advocate for are not yet born, and so they don't go on strike. But I think the most important advocacy is to advocate for people who do not know you and who will not even know what you did for them. So in conclusion, we are back to the celery test. So population management. Now we'll go back to our five questions. Is it an option or a priority? We want women to get pregnant when they are healthiest for optimal outcome of baby and mother. Is that not what every organization does? Is that not the aim of even the agricultural policy, that we plant for the best yield? How is it different? After all, the Bible says, unto the earth we shall return. From there we came to, there we shall return. So how different is it? What we do is for maximum impact at minimum cost. That's efficiency. And to demonstrate the unsustainable nature of ineffective population management and what we do. So it is not possible to develop sustainably if you do not look at ineffective population management. In my mind, from where I sit, that is why Africa is just going backwards and going around in circles, despite the natural resources, because you need that human capital to harness the natural resource. And ineffective population management does not harness the natural resource. It just increases the numbers. It's like the football that's going on. It's not only about activity, it's about results. So life is about results and not just activity. So that's the end of my presentation. We can have time for Q&A, and then afterwards we can go through the questions again and see. I was given 1 hour, and I think I've been able to do maybe 30 minutes of the presentation, and so we can conclude. So thank you so much for the opportunity, and thanks for listening.
Thank you so much for this very interesting lecture. I learned that the three main determinants of population dynamics are birth, death, and migration. And I like the fact that you are looking at the issue from the root cause, the foundational aspect of population dynamics. I would like to ask, rapid population growth makes it difficult for low-income and lower-middle-income countries like our country, Ghana, to afford the increase in public expenditures. In light of this, what is the population limit for our country? Would there ever be stringent measures to control the population if, let's say, the education that is being given out is not adhered to?
Thank you so much. That is a very important question you have had, and I really thank you for that. You know, population, like any service, has its limits. For instance, for your body weight, they will tell you to take paracetamol 2-3 times a day. Is that not so?
Yes.
Exactly. Yes. So for a healthy outcome of mother and baby, pregnancies below 18 years are totally discouraged. So children should not have children. That is why when you go outside, you do not see children with children. That is number one. So that is number one condition. So if children will not have children, we will be implementing a population policy. I told you about 550,000 adolescents within 5 years had children. There is a document I read from another country, 16,000 of their teenagers had children out of a population of about, I think the whole population of that country was about 60 million, and 16,000 of the adolescents had children, and for them it is a national public health emergency. That is how they have termed it. Do you understand?
Yes.
They termed it a national public health emergency, and they're putting measures in place. Yes. You know, our teenage pregnancy rate is about 14%. You go to the Asians, it's less than 1%. So that is it. So that is number one condition. That is the too early. Then too close. Why do farmers, when they harvest, they leave the land to fallow before they plant? For optimal outcome. Too close pregnancies don't give you optimal outcome. So research, science shows that pregnancy, interpregnancy intervals between 2 and 4 years gives optimal outcome. So you obey that one, okay?
Yes.
Between, yes, 2 and 4 years gives optimal outcome. That is it. Research has also shown that the first pregnancy, okay, below 18, above, some people put it at 35, others put it at 40, are high risk, which means that between the ages of 18 and 35, you should have had your children obeying the 2 years interval. So you cannot be in excess. It is like your BMI. Do you understand what I'm trying to say? Yes. So when you obey certain rules, you see, if I tell you that have 3 children and you have them every 6 months, it's not good enough. Do you get it? Because you will not be obeying the rules of optimal outcome. So too early, too close, less than 2 years interval, too late, the first one above 35 or 40, then too many. The research shows that even when you obey these intervals, mortality increases with the 4th and 5th pregnancies. It is like they tell you that when you go 100, 120, your risk of dying increases with a tie burst. So those are the conditions. And that is what countries are using. Every country is universal. It is like your sugar level, the normal range. It is like your BP, the normal range. So it's not like for Ghana, we want our BP levels, our normal BP levels is 160, 80. And for UK, normal BP levels is 120, 80. And for Japan, normal BP levels is 200, 100. Amongst the human species, there's a normal BP level among human species. And I'm sure among elephant species also, there's normal BP level. So those, do you understand where I'm coming from?
Yes, I do.
Exactly. So that is it. So there are some conditions that you obey. It is not by a chance that there's high mortality in child marriages and then in teenage pregnancies. Like one of my professors in Emory said, he said science is common sense at its best. That's what he says. He said that is what research and science is about. It is common sense at its best. You are doing this thing, you are dying. When you stop, you don't die. And science says when you stop, you don't die. What is it? It's common sense at its best. So when we obey those rules, we will also be on the path of sustainable development. Look at a country like, let me just give you one figure, then we'll move on. A country like Nigeria, okay? 40 years ago, the population of Nigeria was about 40 million. And the population of UK was about 50 million. Now UK is 66 million, Nigeria is 200 million. Even with the high, even with the high mortalities. You get it. So it's inefficient.
But all these things you are talking about, it's like it still boils down to personal choices. People obeying it or not obeying it. But then
not really.
Okay.
Not really. You know, not really, because you see, whatever you make free and cheap, people would overuse. I don't know whether you remember when we changed the energy to postpaid. When
Yes,
the
I do.
you remember?
Yes.
When it was prepaid, we were not putting off the lights in our houses. But when it became postpaid, now everybody is careful, put off the light, otherwise the light will go off. We became
Good.
conscious because we are paying. If the government continues to give us free maternal and does not offer us family planning services and encourage us to do family planning services, I'm telling you, it won't work. But if he gives us family planning services for free and tells us that, you know, these are the increased mortalities in these things, and the government cannot be there to supporting increased maternal mortality. And so I'm going to go by the science. I'm going to do this after this level is free cost recovery. It would let us sit up.
Okay.
Do you understand? It is not
Yes.
controlling. It's giving you the choice, but you are paying for it now. So you will sit up. You know, when we sit in the planes, why don't we all go and sit in first class? Because we can't afford, so we buy the economy. But if they said that you can just go sit anywhere, you think we'll all
Anywhere.
go? Exactly. You understand? If they said they
Yes.
open the plane, the one who goes first sit wherever, you think we'll go to the economy? We won't go there. We'll all sit in the business. So
Or
that
I
is it.
should be the first person to sit on.
Exactly so, you know. So
Yeah.
policies just helps you to take the behaviors that we think are helpful. You know, when they said take your girl child to school, they made it, which means that they encourage you to take the girl child to school. Do you get? They made it attractive. They made it easy for you to do. So that is how policies work. But it's not. It is a personal choice within a bigger choice for national good and for public good. And that is what leadership is all about.
That's right. A quick one before I open the floor for the audience. Please vote. While you deal with the foundational cause, then we also have the effects to deal with. So would you please tell us what you're doing for the effects, how you're dealing with the effects, managing the effects of what has already been done, whilst you concentrate on you focus on the foundational stuff.
Yeah, thank you so much for the question once again. You know, everybody is dealing with the effect. The Ministry of Health is dealing with effect. The Ministry of Education is dealing with effect. The Employment Ministry is dealing with effect. The Gender Ministry is dealing with effect. Nobody is rather looking at the cause. Do you understand?
Okay.
Nobody is rather looking at the cause. We're just dealing with the effect. But we cannot continue to deal with the effect, I mean, in a more sustainable way if we do not look at the cause. You get it? And
Yes.
it is destroying the educational system. It is destroying everything. We could move faster if we had looked at the cause. You understand? So everybody is dealing with the consequences, and nobody is looking at why this is happening. Why is this happening in Ghana, in Africa? It's not happening in other countries. You know, why is it not happening in other countries? We all travel. Why don't we see child marriages? Why don't we have these pictures I have shown? Why don't we have white people digging in the this thing? Why are the whites not traveling apart from when there's wars in their places? Why are they not traveling and dying on this thing? You get it? So we are all dealing with the causes. We are not dealing with the, I mean, we are dealing with the consequences. We are not looking at the cause of it.
Thank you very much. Please, the floor is open. I would have loved to ask the third question because looking at your profile, I really, really admire you. And I wish today there was a second session just focusing on you. But yes, you're a great woman. Like, I could not summarize your profile. That's why I had to read it all out. Every sentence is filled with an achievement. And I'm glad that a woman has done this. And I really, really admire you and I appreciate God for your life. I would like to open the floor for anybody with questions. This is a very important topic which affects us directly. So please ask questions and get all the knowledge you need. The floor is open. Any questions, Derek? You have any questions? Is he there? Okay, Dr. Appiah, I realized that you studied in Ukraine, so you're part of us, like Sotka. Could you please give us advice? You have been where we are now, and definitely there will be one or two things you would like to leave with us, like for our personal growth, like how you have grown. And please.
You know, I thank you for the opportunity and engaging you. I hope you will go through the quiz again and answer the questions again for yourself. So the first one is, population dynamics affect you personally. So you can answer, does it affect you personally?
Yes.
It does.
It does.
It does, yes. It does. It does affect everybody. Does it determine quality of life and life expectancy?
Absolutely.
It does.
Absolutely. So is it important for government and private sector to promote family planning education and service provision?
Yes. Yes, yes. From after the lecture, I think everything is.
Everything is yes. You know, family planning, it's an economic intervention. It is not a population, like a controlling intervention. It's an economic intervention, like education. Without family planning, education is suboptimal. So that is it. So I'm happy that you have invited me. And the advice I would want to give you is, I think why is important. You should always ask why. It's something I never stop asking. Why is this person doing what she's doing? Why is this person behaving how he or she is behaving? Why is he saying what he's saying? Why are we having so many funerals? Why are we doing this? Why are these people living long? Why are Japanese living 90 years and we're not? When you ask why, do you know what it does to you? It opens you up for more knowledge. If you don't ask why, you don't look for the answer. But if you ask why, it opens you. And when you keep asking why, one day, just what you are passionate about will just be in your face, and you cannot stop by keep asking why and going on that trajectory. So it is important that you ask why and be humble enough to learn and know that the more you learn, the more there is also to learn. So that's the advice I would give you. That's basically what I have to say.
Please, a last one. Someone put in a question in the chat. Says that I am grateful for today's lecture. I would like to ask the doctor that since every ministry is facing the effect, what can be done collectively to solve it from the ground up?
That's a very, very, very interesting question too. You know, luckily last week, we inaugurated the 25-member board, statistics advisory board, to inform and try to change the way we're going. And for me, that is the most important board I'm on, which was inaugurated, no, this week, not last week, this week. And we'll be sitting and be looking at it. Because without looking at your population, without looking at your birth and death registry, without making your family planning easily available and accessible, forget it. You can't go anywhere. And so we're looking at it from the root cause, and we are using data. So it's not my opinion, but data-driven evidence. Life is full of decisions. And so the best decision you can make is data-driven, evidence-based. So that's what we are doing. So basically, that's what I can say. We've taken some time to get here, but I'm sure that, you know, with population, when you get on track, everything starts improving. That's how it is. When you get on track, everything starts improving. If you are able to abolish child marriage, if we are able to make children be children and make sure that parents are also responsible. Parenting is not for everybody. Just like even this football, if I say I'm going to play, they will say I don't qualify. That is how it is. There is qualification for everything, every single thing. If they have allowed all of us to go and play the football, we won't get anywhere. Because we do not qualify to play football. Children do not even qualify to vote 4 years, but they qualify to give birth. Which one is more important? Which one is more demanding? You get the drift. Exactly. Yeah. Yes. So we have to use data to support. We cannot be hitting in the blind and making mistakes along the line and all the way. So data driven, and that's what we are doing with the other organization. It will take time, but when we get on track, we'll surely get there.
Oh, wow. It will take time. We'll get there. Thank you so much, Doc. Thank you. Thank you.
Thank you too for the opportunity.
You're welcome.
So I'll share the slides with your coordinator.
Thank you. Derek, do you have something to say before Doc leaves?
Yes, I think that I can't be more happy than I am this evening for the opportunity to listen to this great lecture. When the topic came, I think that how I perceived the way the lecture was going to go has really gone a different way, and I've learned a lot. And I must say that personally, I'm grateful for the opportunity to have heard from Dr. Leticia Appiah. It's been very insightful having this hour lecture from her. And then this wouldn't be the only time that you are listening to her. I think that there will be subsequent moments with her when we can also get that feed from her side. So thank you very much, Doctor, for coming. We are very grateful. And then have a very good evening. I think that the national organizer would also have something to say before we leave.
Can I chip in? This is for Doc. Doc, you have won a soul here with your great lecture. It says that thanks a lot. I'm a medical student and I'm convinced that I would have to join the fight to make it possible by continuing in her footsteps.
Thank you. It's so important. Thank you so much. Thank you. So we'll link up and then we'll see what to do. Okay. Thank you. So bye-bye.
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 Or the national organizer. Oh, Doc.
I'm still
here. The national organizer, can you please speak?
Oh, okay. Okay, so I'm going off.
Good evening.
Oh, good evening.
Am I being heard?
Hello? Yes, clearly.
Yes, okay. Thank you very much, Doc, for this opportunity. Actually, as Mr. President just said, we initially thought the lecture would have been something way different from what was actually published. But so I've been to a lot of lectures online and even in person. I think this is one of the best, I think maybe the best lecture I've had. I've had insights that I've never thought of ever in my life. That's, oh, okay. Yeah, we had an idea to a specific extent that this was a problem, but not to this particular extent. So that's why I put the question to you by typing and saying, by asking that what was the collective way to be able to do that within each ministry? Because in Ghana, each ministry is trying to solve its problems, because the effects are bound to hit each ministry. But I think the best way would have been they all sitting down and saying, okay, this, and that is what you just explained, that there were that 25 member and I think then that is a good way step forward. So yeah, that is why I secondly said again that now, yeah, I'm in med school and I'm in the 4th year now.
Okay.
With medical students, we mostly just right after here go directly to the medical field and start like.
Yeah.
I think there are other places now I think we will have to channel our energy into, not just the particular route. And that's why I think I'm now convinced that definitely I'm following in your footsteps.
Good.
Yeah. So one day I hope to also get this PhD and also be able to brag about it. And we are going to definitely put a particular recording on our Nugs platform. And I'm sure maybe going back or after 10 to 20 years, we can come back and I think I can affirm that I was able to follow your footsteps. So on behalf of the National Executive Council, I would like to officially thank you very much once more. Thank you very much.
Thank you. Thank you so much for having me. I'm excited. As for life, it's like a relay, you know. You hand over, and then you keep improving. Hand over, do better than the previous. Hand over, do better than the previous. So I'm excited about it. Because as for life, the starting point is so important. When you start and going the good direction, you will get there. But when you start and people are going forward and you are going backwards, you do all the activity and no results. And life is about results and not activity. So thank you. I'm happy I engaged you. Because of you, I actually stayed in Tamale. Otherwise, I would have been on flight at 5, and so I'm leaving tomorrow morning back to Accra. So thank you, and enjoy the rest of your day.
You're welcome. Have a safe flight tomorrow.
Thank you. Bye-bye.
Thank you, everyone, for joining in. Have a good weekend. Bye-bye.
Please, the recorded version will actually be on the Nugs website and also on our YouTube channel. So you can inform people that missed the lecture to go to those particular platforms.